Hello, March 12, 2020 is World Kidney Day, and on this occasion, on behalf of Team Nephrology at MGM Hospital, Vashi, I wish all of you very happy, healthy and functioning kidneys. Now, as you all know, kidneys are our body's complicated washing machine, and they do the complex job of making urine and get rid of all the waste products of metabolism, get rid of the extra fluid, maintain the chemical balance, acid-base balance, electrolyte balance. In addition, they regulate your blood pressure, a very important role. They also help in keeping your bones healthy and also produce red blood cells. Now, unfortunately, kidney disease is now an epidemic, and there is an estimated about 850 million people worldwide who are now suffering from kidney disease. 1 in 10 adults, not a very small number, 1 in 10 adults have been known to have chronic kidney disease. In addition, there are various other problems that come with kidney disease. One is kidney disease also poses a high risk of cardiovascular problems, and a lot of times, rather than progressing of their kidney disease, these patients actually unfortunately end up dying because of cardiovascular diseases. Now, as your kidney function gradually declines to the point of kidney failure or end-stage kidney disease, a patient has only two options left for survival. One is either remain on lifelong dialysis support or to go for a renal transplant. Now, if you imagine the cost burden of these therapies, it is huge, and most patients, especially those coming from the lower and the middle income countries, it is impossible for them to afford this kind of care or even have access to this care, and sadly many of these patients actually end up dying. The other big problem or rather challenge with kidney disease is it is a silent killer. Almost 90% of your kidney function can be lost, and yet a person may not have any symptoms, and by the time symptoms appear, it may be too late and irreversible. But there still is hope. Kidney disease can be prevented, and the progression of kidney disease towards renal failure can be retarded if we adopt a few lifestyle measures and also focus more on simple early diagnostic tools and early intervention in terms of diagnosis and treatment. Now, what are the two main causes of kidney disease? They are high blood pressure and diabetes. So you can imagine that if the burden of hypertension and diabetes increases, on a parallel note, you will find a simultaneous increase in the burden of kidney disease. So what can be done to protect our kidneys? There are 8 golden rules which have been talked about to protect your kidneys. Number 1 is, let's start to get fit and be active. The more we move, the more we exercise, the more we walk, we keep our weight in check, and that in itself will keep our blood pressure under better control and help in protecting our kidneys. Second is watching our diet. Now, the recommended salt intake is about 5 to 6 grams per day, whereas our Indian diet more than exceeds, almost double this recommended salt intake. So we can start off by first cutting down on the amount of salt we eat, maybe a little bit, even a teaspoon or 2 teaspoons per day if we limit the salt intake and cut it down, and get rid of the salt shakers, try to avoid junk food, look at the labels of what we are buying, and try to cook more at home, think fresh, eat more of fruits and vegetables, don't take junk food and processed food. We can do a big impact in terms of preventing high blood pressure, diabetes and health, and also protecting our kidneys. Thirdly, screening. Routine body checkups for checking your blood sugar levels will help diagnose diabetes early, and then you can work with your provider, healthcare provider, to help and keep your blood sugars under strict control, which will again help your kidneys. Simultaneously, blood pressure checkups during your routine body checkups, physical exams will help in diagnosing high blood pressure early and also help you in controlling your blood pressure if you are aware about the condition early. Now, we need to keep ourselves well hydrated, because dehydration will also pose a risk of acute kidney injury, make you at risk for forming kidney stones, and generally about 2 to 2.5 liters in a cool, comfortable climate per day of liquids is enough. But if you are working in a hot, humid condition, you may require more fluids to keep yourself well hydrated. But if you are diagnosed with kidney disease, you need to follow the strict fluid restriction which your doctor has set for you. Now, avoid tobacco, smoking, chewing, tobacco in any form is injurious to the kidney. So you can do yourself some good by just cutting out on tobacco and avoiding smoking. If you have a history of diabetes, high blood pressure, obesity, or a family member who has kidney disease, now these are risk factors for you to get kidney disease, then in that case don't wait for symptoms to appear. Go ahead and screen yourself for kidney disease on a routine basis, and there are simple tests. By doing a urine exam, a urine routine will tell you a lot about whether there is protein or blood being leaked in the urine, which you may not be aware of. Secondly, get a blood test for a serum creatinine, which will help to calculate your kidney function in the form of GFR, and also go for your routine annual physical checkups. Avoid over self-medicating, especially the painkillers belonging to the category called NSAIDs and unnecessary antibiotics and herbal remedies. These could be injurious to your kidney. So these little lifestyle measures and being more aware and vigilant about kidney disease will go a long way in terms of protecting our kidneys, and together we will be able to take steps towards wiping out this epidemic.